Hello, my name is Katrina Harkins and I am a dermatology registrar and honorary research fellow at the University of St Andrews in the UK. I'm here as part of the research team which has recently completed the study entitled The Widespread Use of Topical Antimicrobials Enriches for Resistance in Staphylococcus aureus Isolated from Atopic Dermatitis Patients. We conducted this study to determine if there are differences in the antimicrobial resistance profiles of Staph aureus isolated from children with atopic dermatitis in comparison to healthy children without atopic disease. And we did this by collecting skin swab samples from children with AD and comparing them to nose swab samples from children without AD. We then sequenced the bacterial genomes of these samples and tested their sensitivity to 16 of the most commonly used antibiotics. What the results of our analysis show is that Staph aureus from children with atopic dermatitis and those without have on average a similar number of antibiotic resistances per isolate. That is to say that Staph aureus in children with atopic dermatitis is overall not more drug resistant. They are, however, more likely to be resistant to the antibiotic fusidic acid, and we showed that 24% more of our atopic dermatitis cases were carrying this drug resistance, which is important as it's a very commonly used treatment in atopic dermatitis. When we compared the genetic basis of this specific resistance between our cases controls, there were specific mechanisms associated with atopic dermatitis, notably a point mutation in the bacterial genome in a gene known as FUSE was 4 times more common in our atopic dermatitis patients, and this is relevant because this specific mechanism is indicative of prior exposure to the antibiotic. Finally, our analysis revealed that atopic dermatitis cases were 8 times more frequently carrying genes known as quack genes, which are important as they've previously been linked to reduced susceptibility to antiseptics. So the results of our study are relevant to dermatologists and our patients as they highlight the collective impact that our prescribing practices have on this organism and the likelihood that it may reduce the effectiveness of some of these treatments that we use for atopic dermatitis patients, particularly fusidic acid. It highlights that we need to readdress and assess our practice in terms of antimicrobial usage. With growing antimicrobial resistance, antibiotics are an increasingly precious resource that we need to use carefully.